the screen here. Share. Okay, are you guys seeing the PowerPoint?
We
Yes.
are, and before you get started, Ed, I'm just gonna do a kind of a quick introduction because this was something that the Leadership Council requested, and it's been a few months now, but by the time we get things on the agenda, sometimes there's some delay. So just kind of want to remind folks that this is something that you all were interested in hearing about, and I'm super excited that Ed is here to talk to us about this work. We've been, the network has been working with the jail for a couple of years now, and they're just doing some fantastic work that's really affecting the health of our community. So kudos to them for all their hard work, and I look forward to hearing more about it. And thank you so much, Ed, for being here today.
Absolutely, and we appreciate working with the Health Network, shown up in 2018, I think it was, and coming from a fly on the wall to a big player, and seeing the bigger picture that it's not just for the jail and for the county, it's for the community. We're fortunate, and we're getting recognized. Part of this presentation, if you watch my previous one to the Healthcare Authority, to the state, some of the stats are kind of overlaying, but I've expanded on it more locally. I know Roger's giving a presentation right now, Dr. Schaefer. He's our research affiliate through Central Washington for the COSSUP grant that I'll talk about. He's given a presentation either this week or next week somewhere at a federal type meeting. The Department of Justice has seen my presentation, and actually I just was recently invited to the Washington State Probation Association spring conference to give a presentation. So it's a good feeling. I've been trying to help other rural counties and other smaller jails on some of this stuff, including grant procurement and how we work as a group. So it's nice to hear, and it's something great to be part of. So same for the jail, working with the Health Network. It's been a blessed relationship. So some of this might look like repeat, but some of it will be new. For those of you that don't know, oh, there we go. Why is this not going forward? There we go. Okay, so my camera is over here and my screen's over here, so I may unfortunately be no technical difficulties. Okay, so that's me. That's my contact information. I'll put it up at the end. We are very transparent. Sheriff Myers, Superintendent Panatoni, if you guys want to tour the jail, if you want to get further understanding on how we're doing some of this funding and relationship work with different partners in the community, they're all about it. Getting to get out and sell and show what we're doing is one thing, but helping others, because it affects the whole state, it affects the industry, it affects the whole idea. So any questions you guys may have, or you see me out in public, please feel free to say hi. A little bit about the jail. We were originally built in 1983 for just 45 beds. That was part of a state process for jail standards. The original jail is still in its same place on 6th Street, north side of the courthouse. We expanded in the 90s to double occupancy to hold 115. Basically, it double bunked up every single cell that they first established. We added the annex in 2012, taking the capacity to over 200. For those people that have been in Kittitas long enough, you used to be able to walk through the old sheriff's office, which is now my office, connected to the jail, through the nice grassy knoll to the DOL and the courts. Well, that's now the annex. We're the only jail in the county. We serve all local and state entities, from Department of Fish and Wildlife and State Patrol, Kittitas County Sheriff's Office, Ellensburg, Cle Elum, Roslyn, Kittitas PD. We also have contracts with the Department of Corrections as well as the United States Marshals. So we do get inmates from all over the West Coast that get housed here through the Marshals, and then specifically DOC is more local people that have to spend their time for Department of Corrections. A little bit about jail statistics. It's kind of important to know there's a big dip in 21. Actually, the beginning of 2020, for the first 2 months, that it kind of threw us for a kind of a skewed number here because we had a contract at the time with Whatcom County Jail and we were running about 135 inmates. The pandemic hit, a lot of booking restrictions hit. You can see that the length of stay went up because people that were actually allowed to get booked in jail during the pandemic were more serious crimes, threats to society. But you can start to see those numbers in 21. They were still affected. In 22, they went up. I will tell you so far, I just ran the numbers for 2023. In January, we were still at that 78, 79, but for February, we ran in the high 90s. Some of that has to do with courts are finally catching up. People that have sentences are finally able to serve them. The COVID procedures through CDC, the Washington State Department of Health, our local public health, even though we've had a couple minor outbreaks, we've continued to lower our threshold of who we can bring into jail. And so it's kind of building that up. You can see the length of stay is still going upwards. That has some good and some bad. The good is obviously we can get them some services. They're not coming into jail and turning around 72 hours being released. We can hopefully get them in touch with one of our community partners or started on MOUD if needed. And then one of the other interesting facts that we track a lot, and it's one of the things we talk about when we do our grant writing, our reporting, our presentations is, we have 3 major highways that drop into this county. We're directly in the middle of the state geographically. And so we keep an eye on how many people actually from our own community are booked here. And since the pandemic, and we're kind of using the pandemic as a swing in the pendulum, just because it changed a lot of our industry. And when I say our industry, I mean law enforcement. There were some legislative changes, but it really changed on how jails ran because there was a gap where it was hard to collaborate with other jails to pick up inmates on warrants, or people weren't, traveling as much through our county. There's all these variables and it's really hard to say, but you can see that the percentage of those booked from Kittitas County has almost gone up 20% since 2019. Again, that's because we're seeing more and more of the locals who are reoffenders coming back to jail, or we're not getting as many out-of-county warrants because people don't participate in the statewide shuttle. So it's good, it's bad. We'll talk a little bit more about that, but that's a number we track as well. And that plays into when we're doing services and how we get them those services. So why do we have programming? In 2018, Superintendent Panatone came in and he came in guns blazing. And we kind of sat down as an administrative group and we looked at the trends of incarceration, legislation, laws, the community, recidivism, and how we wanted to change it. And the first thing is we, about that same time, we had a change in sheriff. Sheriff Dana stepped down and Sheriff Myers filled the role. And we got a new office vision as an entire office. And it's a physical infrastructure and agency culture that enables us to provide the same level of service to our community that we would to our own families. So when you put in that family aspect, you really open your eyes and you really start to realize that if this was one of my loved ones or one of your loved ones or a friend in the jail, we don't want to go the old modern, throw the keys on the wall, Barney Fife, and just let them serve their time. It needs to be productive because it's going to change a lot. So we realized what we've been doing wasn't working. So how do we change it? We started looking at Maine. Maine had just incorporated the MOUD program in their state prison systems. They were one of the first ones to do it as an entire state. We looked at community groups. That's how we got involved with the health network, the behavioral response group, the opioid response group. Here we are in my 3rd pandemic. I was talking to somebody about this yesterday. I've been here almost, excuse me, a little over 18 years. And I went through the marijuana pandemic and I went through the meth pandemic. And now we're in this opioid pandemic and we have fentanyl kind of coming in as part of that, but taking it to a new level. Excuse me real quick. So what we had been doing wasn't working. So Superintendent Panatone, we sat in a room, we had war boards. It was like draft day for the NFL. And where could we take this jail? We wanted to be put on the map. We wanted to do the right thing for the right reason. We were developing the necessary working relationships with our community partners and beyond, so those who are released can become productive members of society. And then we were bridging that gap and helping not only those in need, but changing the lives, affecting their families, and changing the course of the justice system. For this presentation, I'm going to talk a lot about our jail programming, and I reached out to each program and I asked specifically how they're funded, what they provide, their services, and then what their goal was. And I actually didn't put everybody's goal, because our two bottom goals is the jail, our vision of changing somebody, making them a productive member of our society or community or wherever they end up, and affecting families, the judicial system, and changing lives. Everybody has the same goal. So that is one reason when we get new program, the most recent one being David Douglas's group down at the recovery organization, we all have to have the same vision, and that's how we sell this to the sheriff and the commissioners and grants and anything we go forward with. Is if we're not all on the same page, we're all not pedaling the same bike, so it's not going to work. Excuse me. So a little bit about how it was built. Like I said, in 2018, maybe 19, we started getting involved with the local community groups. We used to meet down at the fire station. Me, Sergeant Barnsley, and Superintendent Panatoni would attend, sit in the back, kind of start absorbing things, come back, brainstorm, debrief, figure out how we could become part of this. In 2019, we began the hub and spoke navigation through Comprehensive Healthcare and Community Health of Washington. I'm going to talk a little bit about what hub and spoke is, but that was really the toes in the deep end of the MOUD. What are we getting into? Alicia and her partner at the time, Ashley, kind of came in. This was a whole new idea, and we worked through a lot of road bumps to get where we are today. In July of 2020, we were mid-pandemic. We were using telemedicine rather than transporting inmates out into the community. And we realized we were growing faster than we realized, and that more than community health could really provide for us, because they still have a community to provide for. So we picked up Dr. Azarel and his crew over at KVH. In 2020 of October, we were awarded the BJA COSSIP grant for $600,000. And this grant was specifically for what was considered then MAT, it's now MOUD, funding to build the program within the jail. In October of that same year, Hope Source started coming to the jail, helping those incarcerated with their DOJ Second Chance grant. At the same time, Merit started working in the jail, and I'm going to talk a little bit about each of these programs. An important thing for us in March of 2021, we implemented naloxone for those being released. Everybody on MAT or MOUD gets educated and gets one box, which has 2 doses in it. But it's available to all inmates, and we work with our local health department and the state health department to make sure that we continue to have that on board. The jail staff has it accessible if we have overdoses in the jail, knock on wood, which is becoming a trend problem in the industry. And then in July of 21, we finally fully executed the contract with the health network under the COSSIP for the MAT and MOUD services. That really brought us all under one umbrella. There was the providers are directly under there. The nurse care manager, which I'll talk about, is directly under there. And then we have the other groups that signed on, and Dr. Schaefer for his research, and just kind of, okay, now we've got this money, what can we do with it? In August of 21 was a huge step for us in the jail. We were able to contract Dr. David Geyer. He's a licensed therapist through Comprehensive Healthcare. He works in the jail for 40 hours a week. It really was an eye opener. It's not that the services we were already getting from Comprehensive weren't enough. This just planted somebody in the jail for forensic navigating, assessments, triage, ITAs. It just really opened our eyes and opened the abilities of the jail. And there's going to come more into play in that. In December of 21, we extended our contract with Compass Direct. This is important because it gave us medical staff here for normal inmate care, continuation of care, and follow-up Monday through Friday, as well as we got a nurse who helps with medication delivery, triaging sick call, emergencies while she's in here. In February of 2022, we received additional MOUD funding from the Healthcare Authority for Washington State for $363,000 and some change. And I actually think we've amended that and we're closer to $400,000 at this time. The nurse care manager was finally found. We had a little issue with that. As you guys all know, in the medical field, during the pandemic and post, finding nurses and healthcare providers, and especially someone who wants to work specifically in a jail, is not the easiest thing. So we got Liz on board. That was a great step. In May of 22, we received almost another $500,000 from WASPIC, the Washington Association of Sheriffs and Police Chiefs, strictly for COVID detection and mitigation over 3 years. It's gotten us new equipment, cleaning supplies, protection, PPE, all sorts of things as we continue through the end of the pandemic. And then last year in October of 2022, we received another close to $500,000 from the BJA for Justice and Mental Health Collaboration Program. This is over 3 years. The nice thing about this is it will allow us to bring in additional case managers and therapists under David Geyer to expand our healthcare services. We've seen an increase from 30 to 35% of inmates needing mental health services to nearly 60, 65%, and 40 hours a week is not enough. So that grant was just finished. We're starting the hiring process and the program building. That's an incredible thing for the jail. Like I said, with the upswing. And then this past February and starting this month, we signed an additional contract with Compass Direct for weekend Suboxone delivery, inventory, maintenance, that type of stuff. And then KCRCO began their peer support and recovery group in the jail. So you can see that this has been a very long, tedious building process. And each of these things continue to build. In fact, I just had an email conversation with Pam earlier today that stemmed from yesterday that goes all the way back to the hub and spoke, which was the beginning of this, and then how it's incorporated. So we're continuing to digest, evaluate, adapt, and improve on things. So let's talk about a little bit about the different programs. The first one we have is Hub and Spoke. It's right out of Comprehensive Healthcare. It's overseen by Mark out of Yakima. Like I said, Alicia and Ashley were the first navigators. We've gone through a couple since then. I'm sorry, I cannot still pronounce the new navigator's name, but she's doing great things. It's funded through the Washington Healthcare in 2018. It's a model of care for networking, navigation, getting people right along the way. And I forgot to say this at the beginning. If you have a question at any point, just throw it in the chat or interrupt me. I easily sidetracked. I'm surprised my phone hasn't rang yet. Back to Hub and Spoke. Collaboration and subcontracts with partners to provide integrated MOUD care. They do this for people who are incarcerated and not. Obviously, we use the Navigator for people who are in our facility and becoming clients. They're doing a lot of assessments through referrals, both in the absence and the presence of Liz, make sure that they're getting to the right program. We're continuing to build on that to if someone comes in and it's not necessarily an MOUD, is it something Merit and SUD services can do, something that David and his mental health program need to help with. So we're still kind of building upon that. The Care Navigators offer the case management and the counseling portion of this. Having so many programs going through the pandemic and some staffing retention we're running into and recruitment we're running into right now, we're going to talk about this a little bit later on our future goals, but counseling is a really important part. You can't just give someone a medication or have them attend AA and hope that they're getting out of their past lifestyle. And then I kind of already talked about the other bottom part there. So they're really that navigation piece. And this is where it all began. Hope Source. This has been a great program for us. It started back, like I said, a couple of years ago. Right now it's ran, the two client advocates are Ryan and Brent Neerman. And I'll tell you what, this is a great program. They're funded through the DOJ Second Chance Grant. This type of grant has really pushed them to provide for both those incarcerated and not, but they also have a bigger network. They work with in-county clients and out-of-county clients. On the screen there, you'll see a couple of the things they do, but I know that they've assisted in getting bus tickets, phones. You can go down to Hope Source. They'll help you get a resume ready. I mean, these guys here are case managers of a lifestyle. And this isn't necessarily for an addiction or recovery. This is more for the lifestyle of the individual and how they can get their feet back on the ground, be it through transitioning housing or, all their procedures they have to follow that's based out of this grant. And the services are really intended for that 6 to 12 month time frame. We know that we talk about in the OUD world, the worst chance of a overdose is the first 72 hours out of jail. But this is the things Hope Source offers. It allows these people to maybe change their lifestyle when they step out of the jail, when they're released, and really not get back into that scene. Next up, we have Merit. They provide an SUDP clinical supervisor and certified peer counselor to meet with clients who are incarcerated. They get state grant funding for incarcerated populations, then work with Medicaid or private insurances when people are released. That's one of the things I know they're really good about, is if someone's incarcerated, we know that their Medicaid currently is discontinued, canceled, paused. I'm not sure on the exact legal term, but I know that Merit is good about helping someone getting right back on their Apple Care or their Medicaid. They are a treatment provider for SUD and facilitate access to necessary treatment services by giving assessments and reducing barriers to treatment. They work closely with the courts, with the drug court, as well as the probation department for getting these things necessary to meet the requirements of the courts. They also transition at release from incarceration to engaging in treatment services. They are good about following up with people, keeping on people, calling them, hey, we haven't seen you. We were meeting with you when you were in the jail. So another great program. And I believe that we're going to even further increase their services. And then this is kind of the umbrella. We talked about the COSSIP grant and the collaboration with the healthcare network. It's got the 3 providers under it, the community health, KVH, and comprehensive mental health, and nurse care managers under them. They do have 1 provider, Betty. She comes in 1 day a week. Other support that this grant funded, I get funded for it, part of my duties, as well as the fiscal clerk for reported and billing. Dr. Roger Schaefer, he's doing the researching and reporting and did some focus groups, doing some presentations, and actually this entire COSSIP grant will be published. He's hoping at some point in professional publications. So be ready, because your guys' organization is going to be known as something that helped a rural jail provide something that we need to. And then again, Merit and Hope Source were a couple of the community organizations that tagged on. This was kind of the big kickoff, the big funding, the big, we can do this, but how can we do it with the setting we have? David Geyer, I already kind of talked about him. He's a contracted employer for the county through Comprehensive. The purpose of tasks includes screening for mental health disorders, assessments, treatment, coordination, care upon behavioral health treatment upon transition, forensic navigating, competency restoration, crisis response, and staff training. And he only works 40 hours a week. Well, that's what his time card says. I think he works more than that. He finished his doctorate while he was started here. He's moved up from Yakima, had some really good things that we could learn from his time at Yakima County Jail. They were under the disability rights of Washington. So he knows how to keep us out of the radar and make sure we're doing things correctly. Getting that new grant is just going to increase our mental health services, which is incredible. And then finally, we have the KCRCO. It's a 501c3 nonprofit organization. You guys are all familiar with Dr. David Douglas. He's been chomping at the bit for years. And really, it came down to this. We have been discussing, we have monthly meetings under the previous one, the COSSIP grant, about the programming in the jail, where we need to improve things, tracking the numbers that are provided, and where we can move forward. And one of those things we talked about was peer support. And so I did some research, and Grace Harbor kind of has the same concept with their MOUD program out there in Aberdeen and Montesano, where their jail is. And I kind of talked to their peer support person and said, okay, you have a pretty successful rate. Your name keeps coming up in all these state meetings and groups I'm in. Tell me about it. So we went out and we found that this organization and Mr. Douglas, Dr. Douglas and his group are kind of the missing piece, you know, that person that can just talk on the phone with an inmate or come in and see them or visit them on their tablet and really just help this person realize that life is going to go on and there are people who've been down the same path as you. Now let's get you to be successful like we have been. And so they're facilitating barrier-free access to recovery support, care, and resources. Their big thing is long-term recovery. They're not looking at the short term. They're looking at the long term. They're looking at how can we make this the lifestyle change? How can we work with Hope Source? How can we get you into Merit? How can we make sure you're meeting your provider at KVH, whatever it may be? They're providing education to not just the people incarcerated, but they're helping our staff. You know, there's a lot of stigma about OUDs and bringing Suboxone into jails, or what's the purpose of all this programming. And so Dr. Douglas has presented stuff to our staff and will continually build on that. You know, it's easy for me in the ivory towers, I like to call it, to just come up with all this grant funding and here's more programming, here's more programming and the why, but until they actually hear it from the programmer, I don't think it clicks necessarily with the line staff, the guys that are doing the work and moving the inmates. And then these guys meet, when I say these guys and gals for the recovery organization, they meet a lot one-on-one. They're going to do a lot more of that warm handoff and how can we be there? So we all have one common goal, and it's probably the easiest, but one of the most important stats to track, and that is recidivism. And so we kind of broke this down when I did the presentation for the Healthcare Authority first week or second week in January, the one that was passed around. And we have to take out 2020 because, again, these were people that were in the community constantly being a nuisance or breaking the law and just, you know, were given a lot of chances by local law enforcement. They finally said, listen, you have to pay for your consequences. Or yeah. So I like to just kind of take 2020 out of there and look directly at 2019. This was the induction to MOUD, hub and spoke, kind of the like I said, the toes in the deep end for programming. And we've already seen an 8% decrease in recidivism. That's pretty incredible. Is it a huge number? No, but 8%, when you take that we book 1,000 people a year, 8% of that is 80 people. That's a pretty good number to have. It's something we're going to continue to track. And more impressively, we broke it down specifically for the people in the MAT and MOUD program, because I need these numbers for a current grant I'm writing and for these presentations. You can see in 2019, people that were in the MAT program under hub and spoke, again, nothing they were doing wrong. This was new, but we still had a 21, almost 22% recidivism rate for those people. Okay, now we've gone and added all these additional services and community partners. And in 2022, we got that number down almost in half, 12.2%. That's pretty significant. That's the kind of work we want to see, because people that come in with an addiction or an opioid use disorder, which is now we know an ADA recognized disability, these are the people that were going back out and committing crimes to feed, chase the dragon and, you know, continue to feed their addiction. And so we've done all this work, and you can see that even in 2021, again, take out 2020, because that year there was a lot of variables and trying to pin exactly what it is impossible. We even saw an increase right away once the COSSP was instilled. We'd gone from 40% to 36% in the first half, but we bring in the COSSP grant, the healthcare network, and we saw an immediate drop, just boom. Okay, so is that a reasonable number? We were still pandemic, more people going to prison. We were still trying to learn through this. 2022, we see that 12.2%. We say it is reasonable in the next 2 to 3 years. I am expecting that number to be in single digits. If it's not, I'm going to evaluate why, because this trend shows that we should be in that 8.5%, 9% by 2025. And that's pushing it. We did want to talk a little bit on this number about the program individuals who are affecting the recidivism rate. So what that means is how many people on MOUD and MAT were coming back. 2021, 20% of people on the programming for MOUD, they returned. In 2022, only 7%. That is another stat that's over half. That significantly shows we are making a difference in these people's lives and their lifestyles. We're making a change in their family life, how they're a productive member of the community. I'm sure that you people know the people that are in your programming, and you've seen them on the jail roster or in court or in the news or whatever it may have been, but now you're starting to see more and more of them as community members, seeing them at children's events. Let's be real, we see those incarcerated released at our children's events or in the store, and they're living a better lifestyle. These are the things how we measure success. When I started this career, I thought if 1 out of every 100 didn't come back to jail, I was doing something right. I'm telling you now, I'm trying to say 91 out of 100 don't come back to jail. That's my goal. That is my personal goal. So where we want to go moving forward. Currently, I'm writing the COSSUP grant. It's the same as COSSUP. They changed the fifth initial for the next 3 years. Our COSSUP grant that we're currently on has a sunset of September 31st. I met with the Department of Justice yesterday. Because of the pandemic, because of the issues in hiring medical professionals, including Liz and the nurse care manager, we can apply for a no-cost extension on the COSSUP grant for up to 12 months, depending on what funding's left. So I'll be working with Robin and Sherry, who's our fiscal clerk, when this is released in May. But I can tell you that the DOJ's response to our presentation and our recidivism numbers, that they said this is pretty much going to be a rubber stamp for us because they want us to use all of our funds. So I'll keep everybody updated on that, but that's the goal. This COSSUP grant that I'm writing right now, it's really geared again towards rural jails because it does have some for cities and municipalities, but there's a separate section for rural jails that luckily are we still fall in that category by this ratio number they have. We have a pretty good chance of getting this grant again, but it's going to be to extend the services. So I'm taking the feedback that Dr. Schaefer got, the feedback we've been building on over the last 27 months as a group, and we are going to push this. You know, the cup of opportunity is right at the brim, so I need to cash in on a bigger cup. I'm going to go for closer to $1 million than 600,000 this time. So it'll be interesting to see how that plays out. That's due in 20 days, but I'm not nervous a little bit. We're collaborating with the Health Network recently on the SAMHSA reentry grant. This was a grant that came up on my radar, but it for me was a work smarter, not harder deal. The Health Network's already in place. We're all members of it. And us just being able to get a navigator and implant them in the jail to kind of take all this programming and individually, you know, case manage inmates and warm handoffs and meet them at the door at release and make sure they have everything. This was an easy one for us. I mean, as soon as Robin and her group, Alicia and Doug and Mitchell called, yes, how do we help? That there's no reason that I'm hoping this one goes through, because this is the next step. We've sat through presentations by Captain Beltran at the Clark County Jail. It's no longer the sheriff's office jail. They kind of have the premier reentry program for county jails in the state. Again, they're located in Vancouver, close to Portland, way many more resources. They have 3 jail staff members that this is their full-time job, 40 hours a week. We're not quite there. Superintendent Panatoni would like to be, but again, we're about 5 office deputies down and 6 clerical, I think. We're hiring, if you know anybody, local testing coming April 2nd. But that's the long-term goal. So we saw this as a great opportunity to build it, start looking for sustained funding, how we can be involved in it. We're looking to increase our therapeutic counseling for all the groups, behavior, mental health, MOUD, SUD, dual diagnosis. There's a need. You can't just give somebody a tool like Suboxone or this is how you breathe during anxiety, for lack of better terms, handout without giving them counseling, meeting with them, following up with them. And at this point, I know that this was a conversation we had with community health and kind of Dave. We are on the brink. So I'm going to step aside a little quick. Inmates have two things in their jail cells besides everything else issued to them. They have a cell phone, which is primarily, it's called a chirp. It's for texting with their family and loved ones. And inmates can now have a tablet. This tablet has a lot of good things, but also has pay for entertainment. But we have been working, we've kind of taken CTEL, our provider, and we've pushed their programmers to the limits. And these inmates can now basically Skype with their loved ones from their cell and their tablets. And I'm hoping in the next month or two, I've been having meetings with them, that our providers, our counselors will be able to have non-recorded or recorded free visitations from 9 in the morning till 10 o'clock at night. So if Merritt needs to reach out, or Brent or Ryan with Hope Source to inmate Jones, they can go on, set up a quick visit. It'll pop up on their tablet, and these individuals and programs can do it directly from their office. It opens a lot of opportunities, stops our staff from having to move inmates around the facility, because right now we have to move them to areas there's technical devices they can use. So there's a lot of good things coming to that's going to help with that. Obviously, getting more of the programmers in here with the mental health grant, hopefully the second chance grant, or reentry grant, I'm sorry. Full-time medical staff to get jail deputies out of medical work. This is the long-term goal. 18 years, 2 months ago, when I started in this jail, I delivered medication. I didn't even like taking Tylenol or ibuprofen myself, so I can't pronounce medication names. It took me forever to learn how to even say Suboxone. And so we are building a program with Dr. Diefenbach and his crew down at Compass Direct, this group and the COSSIP grant, where I can envision in the next 5 to 7 years, there's a jail medical director, and all of this falls under one. We obviously like it a lot sooner, but that's going to be one of our long-term goals. Creating standards and programming for other facilities to emulate. I opened this, I kind of got on a soapbox and talked about, how many presentations we're giving. I can tell you that I've been contacted by 3 or 4 other jails on this current COSSIP grant out, and how to apply for it and things like that. We're also getting questions from all over the United States on exactly how we do it as a rural assessments, things like that. So we're kind of just starting to show up on the map. And then obviously the last goal is sustained funding. MHP grant is a good grant, but we're going to be a big player in the 1% and 1/10 tax, because even getting the additional funding through there, it's not going to cover all the needs of the jail. We're going to need to, if this COSSIP grant doesn't come through, or we want to further enhance, healthcare has talked about $5 million coming available this year again, so we'll definitely go for that. But for specific programming, grant funding could run out at any time. And so us having a strategic plan to approach the Board of Commissioners with the community support based on things like we've started under grant funding will be a huge player. So there's my contact information. Like I said, you have any group or organization that wants to know what the jail's doing, this is kind of the main overview at this time. We're continuing to add to the numbers. Some of the programmers on here, or that I mentioned in there, we're starting to track monthly numbers of how many clients they're starting, how many they make contact with, how many are following up. We can give tours. Sergeant Barnsley is a great tour guide. Deputy Holt, our new recruiting and training deputy, can give tours. We've got a lot of neat equipment that the community doesn't really know about. We post some of it on Facebook. It's not really a security issue threat, but We have the same body scanner that you walk through when you go to the airport TSA. We have a body scanner. They're becoming more and more popular in jails. The Department of Corrections now mandatories them. It's kept a lot of contraband out, but we've found through research and other jails that there's still issues with things like fentanyl getting in jails. That's a huge problem across the United States right now. I think I know of 5 or 6 overdoses in Washington state jails from fentanyl over the past couple weeks. We have UV machines for COVID migration. In fact, our medical room, our intake room, and the attorney room, some of you guys use, you'll notice there's a new surfboard or snowboard looking item with a UV light constantly cleaning the air. We were able to procure a new transport van with clean air. So you might see that out and about at community events, touch a truck, cop on top, shop with a cop. Again, we are in kind of a recruitment and retention issue. Nothing bad. It's just kind of, we're at that point, law enforcement, there's a large group retiring and the jail's a stepping stone. And so our guys are getting out to campus and public safety testing. And in fact, we're hosting our first public safety test, I think, ever as a county on April 2nd. So we're reevaluating what these guys do for jobs and how they're compensated. And we're just trying to be a bigger part of the community. So that's my presentation. I don't know if there's any questions. Feel free.
I have a question. I have a question for you. Hi, Edward.
Hi, Sandra.
When there is visits between your inmates and the children that we serve, how does that get set up, and where do those visits occur? How does that work?
So I know that with the video visitation, there was an operational change on it, and I'm going to be 100% honest with you. I've kind of stepped out of the operational world with all this grant management and programming, and Sergeant Barnsley, who is currently deemed the administrative sergeant, oversees the operations kind of by my side. I know that there's been some discussion on that, and if you shoot me an email, because you have my email address,
Yep.
I will get you in touch with him and get that all ironed out, because there's been some questions on that. So,
Okay.
but I know that they changed some procedural stuff, and I don't dabble in that very much anymore because I've reshifted my focus to ensure
Right.
this type of stuff. So shoot me an email.
I will. And then I'm gonna also in the email, I'll put in there that I would like to schedule a tour. You have a bunch of new advocates.
Perfect.
Okay, thank
Yep.
you.
I'll get you set up with Sergeant Barnsley, and he'll take care of both of those.
Okay, thank you.
I think there was someone else jumping in.
Anybody else have any questions for Ed? I think it's amazing, Ed. I mean, you know, it's been not very many years when you really think about it, and how much change you have afforded the jail. Not you in particular, but you know, just made it happen, and that's amazing.
Thank you. Yeah, this is when I don't know how many of you know Steve, our superintendent Panatoni, but I refer to him as Shotgun Steve, because he when he came in, guns were blazing, and we had to move quick, and at some point me and Jeff, Sergeant Barnsley, had to walk in his office and say, stop. Okay, we're beyond. I mean, the technology, just, you know, this programming is one thing, but then we threw in the pandemic, and it forced us to think beyond the box. I mean, the telehealth medicine we set up with everybody for the providers, they're on old county issued iPhones that are locked out right now. We secured some new tablets that we're still building. We've gotten all new going paperless medical records that will incorporate all of our providers for mental health and MOUD and regular medical services that we're incorporating. I don't know if any of you ever go to court or have seen an inmate. They have wristbands now, and the officers have a a device that looks like a cell phone, and this is how we log everything and check everything and film everything. And I mean, this is not the jail I worked in 18 years ago. This isn't even the jail I started as a lieutenant in 7 years ago. And that's kind of where at some point I had to talk to superintendent and bring Jeff on and say, listen, I can't do operations like Sandra just asked about, and this admin stuff, and work with these groups and this programming, because there's not enough time in the day. And there's still parts that I have to work through, use of force reports, evaluation, stuff like that. But it's becoming less and less. And I hate to say that I'm away from the operations part, but I'm enjoying the heck out of this part, and working with people like all of you and solving problems and different issues. But my goal is to secure funding, secure programs, secure devices, and then I empower these guys and say, here, make it happen. So like with Sandra's question, man, I'll get your telecoms all set up. You guys figure out how you want to do it, because I don't work in the jail. I wear a uniform and I go in there once a day and catch up and BS and joke around and check on everything. But they're the troops on the floor, and they really got to make the decisions. So this has been a collaborative group effort. The guys we've lost this year, like I said, they went to the line. We lost a good one to Grant County, but I think we have 4 guys leaving the jail to go to patrol this year. And we're just building a quality jail, and it's getting recognized. And I feel fortunate to be the face of it, because I don't do the hard work. I don't walk the 9 miles a day. I don't have 220 contacts with inmates during the shift. How do we know that now? Because we talk to them, we log it. And the people under me and with me, they're just a great group. I mean, we've really turned this place around. So bringing in this stuff, I just got to sell the pitch and pay for it and keep Steve happy and those guys working.
Right on.
I just want to express my appreciation. I unfortunately have too much awareness of how things are run in some county jails in California, where folks still have to wait for their turn on the payphone to have any contact with family. And to hear that we're moving away from the old county issued cell phones, you guys are light years ahead of some other places I know of. Thank you.
Thank you. Yeah, we're pushing, like I said, with the tablet thing. We are even finding programs like that and making them think larger and bigger. And in fact, the owner of CTEL, his name's Jerry. He's a salesman, former lawyer. I mean, he was emailing me last night in the middle of the night and this morning from the Western Washington Sheriff's Association, where he just had dinner with Sheriff Myers, and we're trying to get the GED program. We found out on the tablets it was charging the inmates, and we're like, no, we want it free because it's GED prep. 6 o'clock this morning, done, it's free. I mean, so we're pushing people, because these guys and gals are already in a hard enough time, taking away access to their family or support services or education. Why it didn't work. So, and to be honest, legislative is going to change it anyway, so why not just get ahead of the curve?
I
Awesome.
think Pam has her hand up. So Pam, do you have a question or a comment?
Yeah, I just wanted to comment. I know I've probably said this before, but it's an incredible experience to be able to work with Ed and the jail, because we can, there's all this programming that, he just went through and talked to you all about. But the thing that we sometimes are challenged with is continuing to bridge that gap for people who are on medication and need to see a provider when they get out. And so Ed is always willing to listen to the ideas that we come up with to try to improve processes and systems. And so, this program wouldn't be as successful, I don't think, anywhere else if we didn't have someone like Ed and his crew working so hard, because it is difficult for people, to have everything taken away from them. They get out in the middle of the night, they don't know where to go, and between the KCRCO and all of the resources that we have in our county, it's just really wonderful to work with the jail. And I think that every time I've asked Ed his idea on something, or could we do something? The answer is always yes. And so we, I think that we've got some great things that are that we're putting together. So I just have to say that as a provider, quote, provider resource, that it's really great working with our county jail.
Thank you. And that's another example. The issue we worked out wasn't really an issue. It was an idea that Mark and Pam and Rachel had been discussing and brought it up yesterday. I'm just kind of the gateway, the gatekeeper, the key keeper, if you remember the old Ghostbusters, but they came up with an idea because they're the boots on the ground. Even these guys, as a provider, work in the jail, do the actual thing, recognized we were missing a part, said, can we do this? The answer is going to be yes. Why? Because it enhances our program. And so thank you for you guys to continue to think outside the box. And I literally have this brain that doesn't shut off at 2 a.m. writing this grant of all the things we've discussed over the last year, and more funding is obviously going to give more abilities and things with that. So thank you guys too. I mean, you guys opened the door, and that's made my job easier. I mean, it's a pleasure.
Awesome. Okay, well,